A young couple named Tommy and Angie were rushed to the hospital at 12 midnight. For a reason, Angie has undergone early labor. She was only a little less than 37 weeks old, specifically 33 weeks and 2 days.
Keep going, yeah. That's a brilliant push.
Deep breath in and again, really big push down.
After 14 hours of labor, baby Tanya was finally born. However, she was premature, weighing only about 3 pounds. Her hair was very fluffy, her skin was thin, red, and wrinkly, and her face almost resembled an old man's. She was showing signs of weak reflexes as well as having a large abdomen.
The parents were worried about the unusual appearance of their child. However, it was reassured by the nurse that this is how premature babies usually looked. Premature babies are not rare in hospitals. However, they are not common either. Most of these babies are vulnerable to many complications.
That's why the medical team needs to be at full attention and focus, as well as give tender care to the neonate when handled. Infants who are born earlier than their due date are usually weak and sick for the same reason that they are not yet fully developed, especially in their movements and some reflexes. Because of this, nasogastric tube is recommended for Gavage because of premature struggles with sucking and swallowing. With that in mind, baby Tanya is indicated for nasogastric tube because she is premature.
Doc, kamusta po lagay ng anak namin?
Okay lang po ba siya?
Sa ngayon ay inaobserbahan muna natin siya, pero po best sa aming assessment ay kailangan po namin isagawa ang paglagay ng nasogastric tube sa inyong anak.
Ano po ba iyon siya, Doc? At bakit po?
Sa mga batang premature, katulad ni Baby Tanya, kadalasan isinasagawa sa kanila ang paglagay ng nasogastric tube sa kadahilan ng hindi pa sila gaanong marunong lumunok at sumipsip sa dibdib ng kanyang nanay. Sa paraang ito ay makakapagbigay tayo ng tamang pagkain at medisina para kay baby, para sa mas mabisang pag-absorb ng gamot sa kanyang katawan at upang maabot ang sapat na calorie at fluid intake ni baby. Ang pinaka-purpose po talaga ng nasogastric tube ay upang makatulong sa pagbigay ng tamang nutrisyon sa kanilang katawan. Papayag po ba kayo?
Basta't para sa kalagayan ng anak namin, gawin niyo po ang lahat para mapagaling siya, Doc.
Maaasahan niyo po kami? Gagawin po namin ang lahat para maging maayos ang kalagayan ni Baby Tanya.
Mga ilang araw niya po ba kinakailangan yan, Doc?
Kung magiging maayos lahat ang buong proseso ng pag-nasogastric feeding kay baby at makumpleto sa loob ng ika-34 na linggo, ay pwede na siyang lumipat sa full oral feeding.
After getting the informed consent from the parents, witnessed by the nurses, the doctor started the nasogastric insertion for Gavage. The pediatrician and the neonatologist prepared first the prerequisites of the procedure, which are 60 cc syringe, stethoscope, water to follow feeding, pH test strips, calibrated glass, clean gloves, feeding bag, if used, prescribed formula, and protective towels.
Before starting the insertion, the nurse made sure that the warm formula would be changed to room temperature by setting it in a basin of hot water to prevent abdominal cramps. The pediatrician instructed the nurse to prepare the formula to be fed to the baby. The nurse took notes of the doctor's order and performed the following. During the preparation of the prescribed formula, she used aseptic techniques in handling the feeding system to avoid introducing microorganisms to the patient. She shook the formula container well, and she also cleaned the top of the canned formula with an alcohol swab before opening it. After that, she labeled the bag with feeding formula, client's name, date, time, and initials.
After preparing the materials, she then proceeded in verifying first the doctor's order, in particular, double-checking the type of formula, rate, route, and frequency of the feeding. The NICU nurse also proceeded in explaining the procedure to the parents to ease their anxiety.
Nurse's responsibility in administering a tube feeding. For the preliminary assessment, number 1, identify the client with name, bed number, patient number, and room number. Number 2, check the doctor's order for any specific precautions, if any, regarding the tube feeding, movement of the client, as well as the position of the client. Number 3, check whether the feed is ready at hand. And number 6, check the articles available in the client's unit.
Masasaktan po ba ang anak namin sa procedure na ito?
Hindi po ba delikado? Hindi po ba baka dahil dyan ay lumala ang lagay ng aming anak?
Huwag po kayong mag-alala sapagkat maingat namin gagawin ang proseso ng paglalagay ng nasogastric tube kay Baby Tanya. Sisiguraduhin namin hindi siya makakaramdam ng kahit anumang sakit. Makakaramdam lang po siya ng kaunting hindi komportableng pakiramdam sa pagpasok nito, ngunit kaunti lamang. Ang pamamaraang ito ay makakatulong din kay Baby Tanya na magkaroon ng nutrisyon hanggang sa siya ay ganap na gumaling.
Nurse's responsibility after inserting the nasogastric tube. Monitoring steps in monitoring a nasogastric tube. Number 1. Confirm again the physician's order for the nasogastric tube, the type of suction, and direction for irrigation. This ensures the correct implementation of doctor's order. Number 2. Observe drainage from the nasogastric tube. Check the amount, color, consistency, and odor, and hematest drainage to confirm the presence of blood in the drainage. Number 3. Inspect suction apparatus. Check that setting, if the setting is correct for type of suctioning, whether it is continuous or intermittent, the range of suction, whether it is low, medium, or high, and the movement of drainage through the tubing is present. This ensures that the correct implementation of the physician's order. This also ensures that the suction is present and correctly adjusted, because loose connections or any kind of blockage in the tube may interfere in the suction. Number 4. Assess placement of nasogastric tube. This may be displaced into a trachea through movement or manipulation. Number 5. Assess the comfort of the client. Specifically, check any presence of nausea and vomiting or feeling of fullness or pain. This may indicate the incorrect operation of nasogastric suction or blockage in a tube. Number 6. Assess the client's abdomen for any distension and auscultate for presence of bowel sounds. Number 7. Assess the mobility of client and respiratory status. From turning from side to side in bed and ambulation when permitted will encourage the return of peristalsis and facilitate drainage. Number 8. Observe condition of client's nostrils and oral cavity. Nostrils need cleansing and lubrication with water-soluble lubricant, and tape must be changed when necessary to minimize irritation from nasogastric tube. Number 9. Monitor overall safety of client with nasogastric tube. Nasogastric tube that is secured to client's nose with tape and pinned to gown allows easier movement. Number 10. Monitor nasogastric tube and suction apparatus at least every 2 hours. This promotes safe operation of system. Number 11. record, and measure the nasogastric irrigations and drainage on intake and output chart according to schedule and agency protocol. Documents description of drainage and client's response on chart. And number 12, replenish the supplies and maintain equipment according to the agency policy and manufacturer's recommendation. This ensures availability of necessary supplies. This also provides for safe operation of equipment and efficient drainage of client's gastric contents.